want to accomplish today, I'll say that just for the camera. I want to talk about philosophy first. I want to do presentation and what's all about. When you do Medicare 101s, they're nervous walking in there anyway, right? Because they think they're going to be sold. Your job is to really take them down, utilize your personality, get them smiling. If you get people smiling, game over, okay? Game is over. So philosophy is more important than what you're actually saying and teaching Medicare 101, because everybody goes up there and goes through the script. I go through the script, but I go through it a little bit differently, because there's things that you should be able to talk about that separates you from everybody else, okay? So let's talk about Medicare 101 today. And this training material is from United Healthcare. Everybody should have these. You should be doing your Medicare 101 with this. You can do it out of your kits, but not necessarily that important, okay? So the first thing I want to do is ask questions. So Karen, tell me a little bit about what you know about Medicare.
Well, I know that there's a lot of letters in this situation, but I don't know where the letters fit.
Okay. Christy, what do you know?
I know that there's something Medsup, Medigap, Medicare Advantage. I'm not really sure what the difference is, but I'm learning.
Are you coming off group plans right now?
No.
Not yet? No? Okay. So
No, I'm poor.
You're poor? Okay.
Medicaid.
You're in the right role for that. Okay, so what I'd like to do today is I want to talk about Medicare. First of all, let me start off with this. If you're doing a presentation, you do it this way. So, first of all, my name is Arnie Fulmer, okay? I'm the principal owner of a company called Fulmer Insurance Group, okay? I am a full-line broker, which means I carry all the products that are out there, or most of the products that are out there in the market. You want to make sure you tell people that, right? Okay? Today, I'm representing United Healthcare. So I have to talk about United Healthcare. I can help you in other areas, but United Healthcare is, because of compliance, I have to talk about I'm going to have to talk about their product, which is an outstanding product today. So my role really here is, as a senior advisor, is to help you understand how to maneuver through Medicare. Okay? Most of the agents out there are going to be reading zeros. 0, 0, 0, 0, 0, big deal. You still don't, you should understand zero because it makes a lot of sense to you, but you don't understand how to use that system if you don't have a broker who understands how to help you navigate. Does that make any sense? Okay? It's important. Personal relationships are important in this business. I want you to understand that. So, if I'm just with United Healthcare, I'm selling a product. If I'm with Humana, I'm selling a product. If I'm with Aetna, I'm selling a product. But if I'm a broker, I work for you, not for the insurance company. So do you understand what a broker is?
Yes.
Okay, good. So let's talk about the basics of Medicare today. So Medicare, we all know. Some of you who are 65 already know this, and some of you who are not 65 may not know this. So when we work for 10 years or 40 quarters in the United States and pay it to Social Security, we're qualified for a thing called Part A. Part A is hospital and anything inpatient hospital. I'm not going to get into all the minutiae today. I'm just going to tell you it's hospital inpatient. That's what you need to really understand. That's what you need to be presenting today. It's hospital inpatient. Now, 40 quarters, I already get it. So how do I get it? Well, if I'm collecting Social Security, it'll automatically be sent to me 3 months before my 65th birthday. If I am not, I don't know if all of you folks know this, if I'm not collecting, then it's your responsibility to set up your SSA account, Social Security Administration account, and order your Part A and or Part B, depending on if you want to qualify for that. Does it make sense? 3 months before, you've got to do it. Maybe I'll get 3.5 months, but it wouldn't let me on my 3-month phone. I went in there and I did that. Very important. Part B now is the doctors and anything outpatient today. Okay? So, what does Part B mean to me? Part B means if I'm not low income today, I essentially have to pay for Part B. Okay? Part B is going to cost me this year $148.60, right? $148.60. I'll pay that every month. Now, if I'm collecting Social Security, okay, they'll automatically bill me for Part A and Part B. I have the right to turn it down, which I'll get into in a second. I'm going to simplify this first. I'm just going to teach you first. Okay, so Part B is doctor. If I have it, then I need to order it through when I set up Part A and Part B, they usually automatically send it to you. But you got to know that you got to pay for it. If you're not collecting Social Security, you pay for it quarterly. You know that, right? Everybody know that? You got to pay for it quarterly. Okay. So, what is Part B? When do I need to get Part B? If I'm coming off of my group coverage, it's called credible coverage today. If I'm coming off of that, then what I need to do is make sure I do it a month before I come off so that I can get these two sync at the same time, right? Coming off group and doing it. If you folks wait until after and do that, then you have to create a special election period. Okay? You got to create a special election period, which is loss of credible coverage, LEC. I don't know if you folks know that either. So you've got to basically do that. So this is obviously the education into this. Okay. So do I need to get Part B? Well, if I'm retired, yes, I need to pick up Part B. Okay? I need to pick up Part B. If I'm still working with a group plan, no, I don't need Part B unless that big corporation makes me do it. Now you want to make sure because your job is to save them money, correct? That's what your job is to do, to save them money. So what I'm going to do is now I'm going to rehash and I'm going to tell you my education. So here's how it flows. So what I want to do is talk about Medicare and Medicare basics for you today. Is it okay? Yes. So Part A is going to be hospital inpatient. Part B is doctor outpatient. Together, they're actually called original Medicare. You folks can, you can folks know it, so you know it's on the Medicare page yet. So it's going to be Part A and Part B is called original Medicare. Here's what it means to you. Ready? Original Medicare is going to cover 80%. Most of you think you work 40 years and they're going to pay for everything. It's not the way the world works today, okay? Pays 80%. So what I want to do is always give an example. Always. So if I have a stent put in, stent surgery is going to cost me, I'm going to dumb it down, it's going to be $100,000. Okay? So if I have to pay 20%, I'm responsible for $20,000. Medicare is going to be responsible for $80,000. But that's not all, because Part A and Part B have a deductible. Just going to round it down to $1,500. So here's a question you need to ask. If this were to happen tomorrow, because a lot of you are here on Part A and Part B, if this were to happen to you tomorrow, how would you handle the $21,500?
Arrangements with the hospitals and pay. Please don't have the money.
How would you do it?
Yeah.
You go like this, right? I can't afford that, right? I'm on fixed income. Okay. So I'm an insurance agent. I can't afford that, right? So the main thing is, it's being recorded, Stella. Come sit down. Okay, so the main thing is if you ask that question, what did I just do? I created exposure. They understand what my exposure point is. Very, very, very important, okay? So that's why you ask that question. So that's what Part A, Part B is. So I don't want you to get nervous today because what I'm going to do is I'm going to show you a couple different options. And you want to explain the options, you want to do this simply. So Part A, so first of all, we're going to talk about a Medicare supplement. Every senior thinks every product is a supplement. Well, it's not true. This is really called a Medigap. And what the Medigap plan essentially does, it picks up some or all of the costs. So let's step back for a second. I reinforced everything, right? So let's step back for a second. Remember that $21,500 I pay? If I was on the F plan, which I can't get on unless I'm older, right? Unless I was on the F plan, that's going to cover 100% of everything. How's that sound? Pretty good, right?
Yeah.
So it's good. But that F plan, I'm probably going to have to pay about $200 a month. I'm also going to pick up a prescription drug plan, probably another $40 or $50 a month. $250 a month. Now I got to pay $250 a month for that, right? That's a lot of money, right? Don't forget the dental and some of the other plans. Great feedback. So that's expensive. But in today's market, you're really going to look at about 5 or 6 different plans. The G plan, G like girl, is one of the more popular plans today. The difference between that F plan I just talked about and the G plan is only the Part B deductible, $203, right? So once I pay that, it covers 100%. But you're still going to look at about $120 a month in this market. Probably going to look at another $30 a month for prescription drugs, so it's about $150 a month. So not bad, right? Medigap programs are really good. You can go to any doctor anywhere in the country that accepts Medicare. It's 99.4% of all the doctors that are out there today. The only ones that really don't take are on concierge service. Okay? Sorry, I'm giving you a little bit more information than I would give the machine. But the Medigap programs are dynamite. They give you great flexibility. That's going to be option number 1. All right? I want you to know this. This is very, very important. Medigap programs, Medicare supplements, are are regulated. They're exactly the same piece. So, therefore, you could have one piece at $100, and with another company have that same exact piece, identical piece, does exactly the same thing for $400 a month. Would you rather pay $100 or $400?
100, of course. But
Get them exposed, right? Get them involved. 100 or 400. So it's very important that you have somebody who carries many of the products that are out there in the marketplace. Make sense so far? Medigap, Medicare Supplement. Now what I'm going to talk about is Medicare Advantage. From October 15th to December 7th, you'll see Joe Namath all over the TV, Humana and United Healthcare, all over the TV talking about Medicare Advantage. Zero premium products, okay? So Medicare Advantage is part of Medicare. It is Medicare. It's Part A, hospital, inpatient. Part B, doctor, outpatient. Part D, prescription drugs are included in most of them. And they call it Part C or Medicare Advantage. Okay? So Medicare Advantage. In this particular market, we're kind of lucky because your average premium today is zero. So I'm going to ask you a very tough question today. Christy, I'm going to tell you, so I want to see if you're on the ball, okay? Very, very challenging question. If the monthly plan premium on the plans that I'm going to show you today is zero, how much do you have to pay every month? I'll give you a clue. Zero. Oh, very good. You're smart. You were listening. I like that, right? Always make them smile, right? Always make them smile. I'm going to tell you, you'll win the game every time. So it's zero. So I know at the end of the presentation, Christy, here's what's going to happen. You know, Arnie, how much do I pay for that?
Yes.
Zero. Right. They always ask.
What's going to cost me?
That's right. Zero. Now remember, if you're still getting Part B, you have to pay that Part B premium. Remember, you still have to pay that. Okay, so the program's not zero. The federal government's paid anywhere from $700 to $2,200 a month to manage your care. Okay, but if you're into that, it's zero. Okay, so that's how original Medicare works. So really quickly, this is a 3 or 4 minute presentation for them. So I'll do it one more time, just for the cameras. Right? So Part A is hospital inpatient. Part B is doctor outpatient. Together they're called original Medicare. What does that mean? If I had a stent put in, it's $100,000 surgery. Medicare covers 80%. I cover 20%, $20,000. Plus I have a deductible for Part A and Part B, which is going to be another $1,500. If that were to happen to me tomorrow, how would I handle it? Tough time, right? We're seniors on fixed incomes, right? I'm on a fixed income too. Okay, I like it. So that's what original Medicare is. So you have a couple different choices. That's option number one. That's where you're at today. Option number one is going to be a Medicare Supplement plan. Medicare Supplements give you the flexibility to go to any doctor anywhere in the country. You choose your doctor. If you tell me I have to keep my doctor, then you really have one option in most cases. It's right here. And those plans are going to probably run you anywhere from $120 to $200 a month. Plus you've got to add a prescription drug plan, and they're going to run you $20 to $135, $140 a month, depending on the plan that you're on. That's what option number two. Option number three is going to be called Medicare Advantage. Medicare Advantage plans in most markets are HMO PPO. HMO means we have to stay within that network. That means we select a doctor and that doctor refers us in the network. If we go out of the network on an agent, we pay the whole thing, handle the compliance. We just handle compliance. We pay the whole thing. The PPOs give you flexibility, but they still have they still want you to keep in that network. If you go out of the network with a PPO, you could pay 30 to 40% of that real cost, of the Medicare cost. By the way, it's very low. So, if you had a choice between the three, staying on original Medicare, by the way, 33% of all the people in the country are on original Medicare. Okay? That's called private fee-for-service. Part A or Part B, where would you prefer to go?
Zero plan.
You want to look at the zero plan, right?
Yeah, zero.
So I'm just going to just touch on this market really quickly for a second. So I just want to give them examples because there's one point that I want to drive home here. Okay, so your monthly plan premium with these plans are how much?
Zero.
Okay, so it's zero monthly. So when I see a primary care doctor in the Vegas market, it's
Zero.
I let them say it. When I see a specialist, it's
Zero.
okay. Unlimited days in the hospital are
Zero.
okay. So one thing I want to teach you. So do you like me so far?
Yeah.
I bet you're starting to like me, right? Okay. So one thing that I want you to do, and I do that all the time, by the way, it's just my silly way of doing things, but the next thing I want you to know, in 1983, when we went to the hospital, they had what they call an open checkbook policy. What that simply means is the hospital could keep you as long as they want, right? 1983, they put a law in there called prospective payment systems. You folks need to know about this when I'm teaching. Prospective payment system now has diagnostic related groups. When you go to the hospital, there's 532 diagnostic related groups. In other words, all the illnesses are out there. So I've got pneumonia as an example. They'll go under lung disease, they'll look at pneumonia, and Medicare says, I will pay for 3 days. Now, if I'm 65, 66, I may feel better than that. But if I'm 85 or 90, I'm in a hospital, am I going to feel better in 3 days? Not a chance. So what the hospital has to do is, unless they code it differently, they have to send you to skilled nursing. Who knows what skilled nursing means? You be quiet. Who knows what skilled nursing means?
It means a facility that's there to help you rehabilitate with better level of nursing care, basically.
Good answer, but not the full answer. Go ahead. So here's what skilled nursing means. You have to understand the language of Medicare, more important than anything. Look at your Medicare and U-Book. Here's what skilled nursing means. So if I'm in there and I'm all wired up, right? I'm sitting there, I'm all wired up, I have to have 24/7 service. That's skilled. Just because I'm in a skilled facility doesn't mean everything's skilled. I watch TV, I take an aspirin, that's not skilled, right? So agents are not telling the full truth. That's because they're not taught. So, but if I'm in there, let's say I'm in there for a while, because day 1 through 20 in skilled nursing is supposed to be 0, correct? But let's pretend that I had hip surgery or knee surgery, and I'm in a skilled nursing facility because I'm older, and I want to do rehab. So I'm up there doing physical therapy in the skilled nursing facility, skilled nursing. I'm rehabbing. Doctor comes in 14 days and says, hey, Johnny, you're doing great. What I'm going to do is I'm going to cut your rehab back from 5 days to 3 days. What's the client going to say? Yeah, the client's going to say, yeah. What am I going to say? No! Why am I going to say no? Why did I say no?
Because it's a longer skilled nursing.
Yeah, longer skilled nursing. Very good. I knew you knew that. They just changed the language of Medicare from skilled to intermediate care. Guess who gets the privilege of paying for intermediate care? You do. I'm going to give you one great example. I'm doing a Medicare 101. Lady sitting in there, husband had TRICARE for life. Okay? Best supplement that's out there. It's an F plan, by the way, for folks know. It's an F plan. Best supplement plan that's out there in the world. She raises her hand because I'm talking about this and talking about a couple of things. She says, raises her hand and says, you know, my husband had TRICARE for life, went into the hospital, and then came out and went to rehab. And he had to pay I had to pay $30,000 out of my pocket. Why? I said, how was your husband coded? Key word that you need to know. How was he coded? Oh, he was they coded him as under observation. Oh, do you know what under observation means? Right?
Means you're not checked in.
That's right. You're not checked in as an patient. Why do they put you under observation? Why does a hospital do that?
Because they can actually get more money out of it.
That's right.
It's more
It's all money. It also protects their butt. Okay? Because if you have to come back again, they're penalized big time. So what you need to know is that under observation is bad. If you have a Medigap or Medicare Supplement program, it says right there in your Medicare U-Book, in blue, highlighted, you must be in there 3 consecutive nights, released on the 4th day to qualify for skilled nursing. Do you think that's important to people out there? How many agents do you think talk about this? I'll tell you in this market. 1, me. Okay? You need to know that. Even if you bring your Medicare and U-Book with you, open up and show it to them. It's about being effective, right? It's not about dabbing, because they don't understand it until it hits their pocket. So under observation is no good. Inpatient is good. I come out, then my rehab is covered. First 20 days is covered. Okay? So once you get through that, if you're starting to talk about those plans, then that's a good thing. You know, in the skilled nursing facility, you know, day 1 through 20, 0, but through 20, depending on the company, to 21 through there, you pay skilled nursing. Generally, the way you figure out skilled nursing is the amount of, if you're out-of-pocket maximum. So they'll take, let's say, $125 a day here in Vegas. It's 7 days. If it's 7 days times $125, that's $1,000, right? It's your out-of-pocket maximum. So skilled nursing, out-of-pocket maximum, tie right in. That's one of the other ways you can hit your maximum out-of-pocket in this market. So really, only 2 ways you can hit this out-of-pocket, and I'm going to finish here, okay? Only 2 ways you're really going to hit it that I know of. One is if I'm in skilled nursing for that period of time, okay? Or 2, if I have cancer. Okay, so if I have cancer, are my chemotherapy drugs on Part B or on Part D?
B. It's B.
It's B. That's correct. So if it's on Part B, what does that mean to me?
You're paying 20%.
You pay 20%. So if the average chemotherapy is $2,400 and I pay 20%, that's how much?
480.
$480. Maximum out of pocket is $1,000 in this market. So now I have 8, unless it's later in the year, right? Because if they roll over to January, then you have to pay that again. But now I have 8 of my payments covered. Do you think that makes a difference to people? Did I just put you in the picture? Do you know anybody who's had it? See, so my whole thing is, I know you folks know most of this stuff, right? But the whole thing about this is put them in the picture. This girl's a master. You do this regularly, don't you? She's very good at this. She has mastered her trade, and she happened to be up here, and I wanted her to come and meet you folks. So make sure you pick Debbie's brain later on. I just want you to know this is how this is involved. The more you have them involved, asking simple questions and confirming those questions, the more effectively they'll be. It's not about giving a presentation. It's really holding the conversation so that they understand that if I have cancer, I'm going to do that. How many people know anybody who's had cancer? Everybody, right? So how do they handle it? How do they pay for that?
They get decimated and they get liens on their mortgages.
Next one who talks loses, right? Next one is sales 101. Next one who speaks loses. I just won the game. Because why? Because I just put her in the picture. No, I just wanted to make a point. It's not.
No, I like
that.
That's good.
I just made a point. So it's not about simply here's what Part A, here's what Part B, here's what that work. So that's pretty much what I have. How about questions?
So what about, I know the answer, but this is a good question, I think. What about someone that stayed home and was a working mom for, say, 30 years, and they want to get on the Medicare? Can they still get on Medicare?
Great.
Because they haven't worked in the field for a really long time.
Awesome question. Okay, so awesome question. So here's, and I want you to throw questions out, okay? So if her husband has worked, there's a lot of housewives, especially in the ethnic cultures, a lot, except for Stella, she works. Just a joke. But a lot of the wives raise the family, so they don't go out and work, so they can't work their 40 quarters or their 10 years, right? It's repetitive. Okay, so she can piggyback. If she's 65 and the husband's 65, she can piggyback off of their Social Security. So you go to Medicare, you take them down Social Security and do that. You should help everybody set up their SSA account. Take you 5 minutes. I know Stella does, right? She walks everybody through everything, which is a real way. So that's a great question. So yes, as long as the husband's 65 and as long as the husband's qualified and has Medicare, she automatically gets it. And if he passes away, it's hers, right? That's how it's paid.
So what if you work in civil service, and we're talking about a long time ago, we're not talking about recent, but if you work in civil service and you don't pay into Social Security because you only have the civil service?
That's a totally different animal,
I
okay?
can tell you that I dealt with the one lady that had, she was a homemaker, and the husband was self-employed, never paid in. So she had no ability to piggyback off the husband, and we had to go through, luckily she had a stroke and went through aging and disability and got a waiver for Medicaid, and Medicaid then paid for the Part A and the Part B to get her on Medicare and changed her life getting her on Medicare. That was one way to get somebody who had no ability to get Part A or Part B through any of their own means, care under Medicare.
I love sitting in with smart, intelligent people. The thing is here with Medicaid folks today, and I don't know if you're running too much down there, and Albuquerque's wealthy. With Medicaid people, if they're on Medicaid, Stella, you want to tell them what they do to get them on Medicare?
They pay Part A and Part B.
Yeah.
Yeah, they pay.
And we didn't know this until a year ago, so this is pretty good stuff.
I just learned
The
this
issue
last
here
year.
is these people's retirement is too much for them to get on Medicaid. So civil service has a plan that they're on, okay? But here's the problem. They make $1,400 a month, his retirement, but they pay $450 a month for that. You can't get them out because they're 81 years old. if I was to go and they tried to get A and B, they're gonna backdate it all the way till he was 65. I got into this with this couple. Felt really bad for them, but there's not any alternative because they never paid into Social Security, they paid civil service.
Excellent. And that brings me, I want to touch on something else. And nobody knows this either. Now, there's only a few people who know this. So, if somebody works in the post office today, right, retires out of the post office, and they're on FEHB, is anybody familiar with FEHB?
I had one person I tried and I couldn't change them at all.
Okay.
She's got all the,
Well,
That was weird stuff.
that's not weird. So FEHB, here's what you need to know. If you're running into somebody who's on that plan, they're paying a lot for their benefits, right? They have a one-time option to suspend their FEHB program and jump on Medicare and Medicare Advantage. They have a one-time opportunity to do that, and they can go back if they don't like the Medicare Advantage.
That's a 12-month trial rate thing?
It's not 12 months.
Okay.
They have a one-time, they can come off.
Anytime?
Anytime. They could go to HR, say, hey, listen, I want to suspend that. There's a form that has to be sent in. HR can handle that. One time, they can come off and jump on a Medicare Advantage. Cost you money, didn't it? Cost you money, didn't it? Because you couldn't write those people.
I went there and I actually got a denial, so I couldn't do it.
So that you got a denial because of the plan, but she could have asked for the waiver to jump off that. Very, very important plan for you to get involved in. I had a fleeting thought on something else.
She was working, I think, for the school district. And she had the same.
Well, they're on PERS. PERS is something different. Okay, the school system is a different system. What PERS does is it gives them an allowance, a couple $100 to pay for those programs. So if they do a stuff. PERS are some of the more difficult people to jump on. So in the school networks, that's more of a challenge. But to answer your question, because you're going to run into this, I ran into it before, where you're just not going to be able to do anything unless they can get them down to Medicaid level. If they can get down to Medicaid level, then we have options. But nobody's utilizing Medicaid enough. Stella uses it all the time because that's really in her target market. We're not doing a good enough job with the dual special needs, even though we're the #1 selling plan here. There's so many people out there that need this help that really don't know it. So just remember, a third of the people in the United States qualify for extra help at Social Security and don't know it. 33% of the whole country. So we're not reaching out. We're too busy trying to sell and not asking enough questions. And this business is better than you
There
could
is
say.
one other, if you're in local, that I just found out about, literally this week, with the Access program, where like I had a paramedic, he was a paramedic for 40 years, he was HIV, and they are paying for his care through the Ryan White program. And so they'll pay for his supplement or his Advantage plan and take care of that cost for him. And before he was on Medicare, they were taking care of him. So we have that here, I guess, in Nevada, Clark County. It's a county
Oh, that's awesome.
thing.
Awesome.
I just found out about it this week, and they're looking to get onto a plan. So, and I had to figure out, they're like, well, you have to do with Rosie at this, and I'm like, I don't know what this is, and I called Alberto and he explained it. And but that is something locally we have as well, that county program that helps pay for care. I don't know what the qualifications or eligibility requirements are, but there's another program that exists that I just found out about.
That's great.
Is he over 65?
Yeah, he just turned 65.
Okay.
So that's why he was aging into Medicare on this county-based program that was help carrying and paying for his health care as an HIV person.
Outstanding.
So it's good to know there are other programs county-based that will also help pay for care if they don't qualify because he makes too much money with his benefits from his job being paramedic. So.
Well, there's one other thing that most of you probably know, but I want to say it anyway. If somebody's on Social Security disability for 24 months, they get their Part A and Part B, right?
That's
no matter what age they are. Everybody know that?
All except for sometimes they skip them. I have a girl right now.
Yeah, which is unusual. Fell
She's been
through the
on 10
cracks.
years. She's been on disability, and she's scared. She's, I can't convince her. I haven't even been, and she's a friend of mine. She's on Medicaid. She's been on Medicaid now for 10 years. She never got her Part A and B. They never gave it to her, even though she's been on disability for 10 years.
Jesus.
They don't want to
And-
do
but
that
she's
because
scared.
it's cheaper for them.
Well, not really. It's
But
not. When you do the D-SNP, it gives them a lot of benefits.
Yeah.
A lot of benefits. And I keep trying to talk. But what if I'm going to mess up my what the doctors I'm going to right now, what if I, what if this, what if that, they got like 1,000 questions that you answer them, but they're still not believing you, I have a girl right now, I'm
That's-
working
I
on-
lost
That's
the deal
difficult
because
client.
they didn't have the Part A.
That's a little difficult client. Do you know her well?
Very well. She's a friend of mine. We graduated together. It's just, she just doesn't trust the system. She doesn't trust
Well,
Medicare.
She trusted it enough for 10 years to be in Medicaid.
Yeah, but that's
I mean,
state.
that's still part of
But
the system, though.
It is, but it's state. You have to
Wow.
realize that's state. It's not, you're not from the feds in,
We should have put this on a podcast. A couple things, obviously there's more that you want to go through with the actual presentation, but what I want to do is accomplish a little bit here about the philosophy of this. There's 10 things here that you should touch on 2 or 3 of these that are in the book. This is actually a presentation for Medicare 101. For you folks that don't know it, you want to talk about the prescription drug plans and stuff like that. I didn't go over it because I don't want to be redundant with some of this stuff, but if you're doing Medicare 101s, believe me, unless you have a network like this young lady here who works her tail off, you really need to be out there doing the Medicare 101 events. Even though you may only get 2 or 3 people out of them, I've sat down with 3 people at a table. I just pulled up a chair and sat at a table and wrote all 3 people at the table. Sometimes you'll get 1 or 2 people there, but you'll get better results than sometimes sitting at retail is boring. You're going to pick up some business at retail. But Medicare 101 is going to do you open. That's why you'll see all the guys that have been in business for a long time, even though it's expensive to go out there and market that stuff, they do the Medicare 101. So you have to be comfortable doing this. This takes practice. I don't do a full presentation with this because I think Medicare Basic 101 is the point that I want to drive home. I really want to sit down with people, so I kind of take a little bit off the table, but if I ever get shopped, I have to go through the presentation, right? So, and I, did quite a few of these things. Araceli said that one day, "Oh, you're the best I've ever seen." This is the first time I ever did this. But it's what I teach. It's the philosophy and how you react, how you're acting with the folks in front of you. It's not about the zeros. Believe me, this business is not about merit. It's about you. They buy you first, and then everything else is second. I don't care. They don't care what you know. Okay? Strike home with their selling point. Find out what it is. Ask more questions. Get them involved, and then teach that way because they'll relate to that. And I'm going to tell you, they'll refer you. This is referral business.